Let's talk about something that can feel, well, super overwhelming. All the different medications out there for anxiety. The names can sound like a foreign language, and just figuring out what they all do is a huge task in itself.
I mean, you hear terms like SSRIs, benzos, TCAs, and if your head starts spinning, trust me, you are not alone. But don't you worry, in this explainer, we're going to cut right through that noise and break it all down.
So let's try to look at this a different way. Instead of seeing a long, confusing list of drug names, I want you to picture a doctor's toolkit, right? Inside that kit, every single tool has a very specific purpose. Some are built for those long, slow-burn projects, while others are designed for a quick emergency fix.
So here's how we're going to unpack this toolkit. We'll start with a quick overview of what's even inside. Then we'll dive into the modern go-tos, the SSRIs and SNRIs. After that, we'll look at the fast-acting options, touch on some really specialized drugs, and then we'll tie it all together to see the big picture.
All right, let's pop open that toolbox. First things first, let's just get familiar with the names of the main tools a doctor has to work with. So these are the big players. You're going to hear names like SSRIs, benzodiazepines and beta blockers, and also some of the older guys like TCAs and MAOIs. Each one of these represents a completely different approach to tackling anxiety. Let's start with the ones you're most likely to hear about first. Okay, first up, let's talk about the real workhorses of anxiety treatment today, SSRIs and SNRIs. When we're talking about managing anxiety for the long haul, this is almost always where the conversation is going to start.
So what in the world is an SSRI? Well, it stands for Selective Serotonin Reuptake Inhibitor, which is a mouthful, I know. But the idea is pretty straightforward. Think of serotonin as a little messenger chemical in your brain. SSRIs basically help keep more of that messenger hanging around and active, which over time can really help improve your mood and dial down anxiety.
Now, this is where it gets interesting. You might think, okay, an SSRI is an SSRI, right? But it's not that simple. Even within this one class of drugs, not all tools are built the same. For instance, one SSRI might be known to be better tolerated, while another could be a little bit more stimulating for some people. And these small, subtle differences are exactly why one might be a great fit for you, and another, not so much.
Right alongside the SSRIs, you've got their cousins, the SNRIs. They do a very similar job, but with a little twist. They also work on a second brain chemical called norepinephrine. You can think of that one as being tied to alertness and energy.
And that little twist, that dual action, brings us right back to this idea of trade-offs. Because SNRIs also affect norepinephrine, they can have slightly different side effects. If you look at this note here for one of the common SNRIs, you'll see a recommendation to keep an eye on blood pressure. It's not necessarily a bad thing, it's just another feature of this particular tool that your doctor needs to consider. So, we've talked about the long game, but what about when you need help like right now? What happens when the goal isn't long-term management, but immediate relief from something like a panic attack? For that, we need to pull out a totally different drawer from the toolkit.
And that's where benzodiazepines, or benzos, come into the picture. These are the power drills of the toolkit. They're incredibly powerful, and they work fast. I mean, really fast, sometimes within minutes, to shut down that intense, acute anxiety.
But, and this is a huge but, that speed and power come with a very steep price. This is absolutely crucial to understand. Just look at the notes here for a common benzodiazepine. It flags some serious warnings: abuse potential, risk of addiction, and a tough withdrawal syndrome. So while they are amazing for a crisis, they are absolutely not designed for everyday long-term use. Now, as a total contrast, let's look at another tool, buspirone. It has a much, much lower risk of dependence. So what's the catch? Well, the chart tells us right here, it can take 2 to 4x weeks to start working. So, it's a completely different kind of tool, not one you'd use to stop a panic attack in its tracks.
So this really sums it up perfectly, doesn't it? It's the classic trade-off. With benzodiazepines, you get incredible speed, but it comes with high risk. With something like buspirone, you get much lower risk, but you have to be patient. It's all about choosing the right tool for the job at hand.
Now let's dig a little deeper into the toolbox and find some of the more specialized instruments, the ones that are brought out for very specific situations, or maybe when the other options just haven't quite done the trick.
Check out this quote right here. It says, "For occasional use in situations such as public speaking or performing." So what kind of anxiety medication do you think we're talking about here? I bet the answer is going to surprise you.
The answer is beta blockers. And what's wild is that these are actually blood pressure medications, but they're fantastic at blocking the physical symptoms of anxiety. You know, that racing heart, the sweaty palms, the shaky voice. They don't really touch the mental feeling of being anxious, but by calming your body's physical freakout, they can be a total game changer for performance anxiety. A truly specialized tool.
Okay, finally, let's talk about the old school tools in the kit, TCAs and MAOIs. These were some of the very first antidepressants ever developed, and while they can be effective, doctors usually reach for the newer SSRIs first, simply because these older drugs come with more significant side effects and risks.
And to give you an idea of why they aren't the first choice, just look at this note for a TCA. It doesn't mince words. TCAs are toxic in overdose. That's a huge reason why they're considered a higher risk option, usually only brought out after the newer, safer meds haven't worked.
And then there's the other old school class MAOIs, which are used even less often. And this table shows you exactly why. They have some really serious, even life-threatening interactions. They can react dangerously with common foods like aged cheese or cured meats, and with a whole bunch of other medications. They're powerful, for sure, but they require extreme caution from everyone involved.
Okay, wow, we've just gone through pretty much the entire toolbox. So how do we put this all together? What's the big takeaway? It's really all about understanding those trade-offs and working to find the right tool, or maybe even combination of tools, for one person's specific needs.
This table really lays it all out for us, doesn't it? It's like a cheat sheet for the whole conversation. You need long-term management? You're looking at SSRIs and SNRIs, but you gotta wait a few weeks. Dealing with a sudden panic attack? That's a job for the fast-acting benzodiazepines, but you have to respect that high addiction risk. Just need to get through a presentation? Beta blockers can help with the physical stuff. And for the toughest cases, you have the older drugs with all their baggage. See the pattern? Every single option has a purpose, and every single option has a trade-off.
So the real takeaway here isn't trying to decide which medication is best. There is no single best one. The goal is to understand that there's this whole landscape of options, and to partner with your doctor to find the right balance of effectiveness versus side effects for you. Hopefully, this explainer gives you the vocabulary and the confidence you need to go have that conversation. Thanks for watching.